I came here for medical treatment. I want to share my experience with you. After giving birth, the nurse told me that my baby has had some abnormality. I had a look. Immediately I get shocked and feeling pain, but I had no choice. I kept quiet.
The clinical photographs of baby Amy were emailed to me from Rwanda, Africa when he was 10 days old. Baby Amy was born with a rare congenital abnormality called exstrophy-epispadias complex. In this condition, the skin over the lower abdominal wall is deficient, thereby exposing the urinary bladder, which is open, and therefore there is continuous leakage of urine that happens in these babies. Along with this, there is genital malformation as well. Over several email exchanges, we planned the surgical outline for the patient, and he came to us when he was around 2 months of age.
Immediately we became admitted in the hospital, like 5 days.
The surgery that is offered for this rare disease, what we did differently was that we undertook a complete primary repair for baby Amy, in which stage 1 and stage 2 were combined, thereby reducing the operative morbidity for the patient and giving the urinary bladder the best chance to grow over a period of time. He recovered very well. There was no post-operative immobilization that we needed to give for the baby.
Medanta, it is a very expertized hospital. Dr. Virender, yes, of course, she is a good doctor. She's careful. She took care about the baby every day. Even she gave her number with text, no problem. I appreciated her. Medanta, it is a good hospital. I have a testimony.